Hi, my name is Dr. Erin Denil with Rejuvenate Life Chiropractic, and today I want to talk about some common postural issues with muscles that we can strengthen for helping our shoulders and our posture, as well as some of the muscles that we can relax. Okay, so in a normal anatomical position, we would want our ear to be in line with our shoulder, in line with our hip, and in line with our ankle if we were standing. What tends to happen as we are doing a lot of things in our society, like typing, is that we slouch, our shoulders curve. So where normally shoulders would be open and back, even while we're up typing over the day, we start rounding. This rounding position is going to cause some problems as far as overall balance, and it also will then start causing problems with how much we can move our arms. If we are slouched and trying to move our arms forward, we're going to have restricted motion. If we are back upright in our good posture, then we are much more able to work in a full range of motion with our arms. So what it will be tight on most people is going to be our pectoral muscles, actually the medial pec major, pec minor would be it. We will also then have a tight biceps brachii, which is the show muscle for our biceps. Then we will have weakened external rotators of the shoulder, which the two, and they're smaller, the infraspinatus and the teres minor, they will do that external rotation. Another one that tends to be weak but does an opposite motion is the subscapularis, which is on pretty much between your rib cage and the shoulder blade. So it sits on the inside surface, and this one does that internal rotation. Okay, so that one is usually weak. Anything that brings in the lats as well as the pecs are another internal rotator of the shoulder. They tend to be strong. The teres major and lat will also do a pull down motion, like our lat pull down. They function there as well as that internal rotation. So we typically will need to strengthen up those external rotators. So anything that we're going to do with those external rotators, the hands are going to be coming out to the side. You can start simple with just what we call isometric exercise, where you would be holding. You can hold on to a resistance band and just come out. And I like to hold 2, 3, release. Hold 2, 3, release. Hold 2, 3, release. That's one of the simplest ways. If you have weights at home, you can use weights. I like to tip forward and then do it. Because you'll get a little more gravity involved with the motion. Okay. Another thing to focus on with this posture is going to be our lower trap. Okay, so the muscles here. Most of us have heard trap being up here. Upper trap does this. Lower trap depresses or pushes down. Okay, so we want to focus, and I have a video on this as well, but we want to focus on holding down. Any exercise that we can do with our shoulders, we can first push down, and it will help us trigger that lower trap. I do this when I work out, so some of the great things, even if I'm doing a lat pull down, I first position, shoulders away from ears, and then I do my lat pull down. If I'm doing a bicep curl, shoulders down, then bicep curl up. Working on external rotation, shoulders down, externally rotate. Okay, biceps, down, curl in. Triceps, down, and then do your tricep extension. Scapular motion in the scaption plane, okay? Same thing, shoulders down. I do these laying down on my tummy most of the time. I do have exercises on my website as well as YouTube for that as well. When it comes to stretching, we have to stretch out all of these that go forward. So we can lay on an exercise ball and open up, hold some weights. We can use the corner of a door or like the corner of a room and lean into it. I do have another pec stretch in which we have a fist of our hand and we rotate away. I can feel this even just doing this motion. I can feel a stretch, trick, keep that shoulder down, then rotate away. You will feel a stretch in the bicep. To strengthen the opposing muscles, we need that subscapularis strengthened, like I said, as well as those external rotators. The subscapularis, the best way to do this, and again, I have a video just on this specifically, I like to pin down the scapula or the shoulder blade. And then I like to take a weight. I put my hand kind of in the area right under that shoulder blade, so the area between the shoulder blade and the rib cage. And then we focus on internally rotating. For subscapularis, it should fire. You can grab a weight, and you can do this nice and slow and controlled motion to help strengthen that particular muscle. Another thing that's helpful for shoulders. A lot of times we will have an impingement syndrome in which muscles basically will get pinned between part of the collarbone or clavicle and another little bony process that comes off of the shoulder blade called the acromion process. And we get like a pinch and an irritation and a tendonitis or an impingement syndrome that gets created. The biceps, the long head of the biceps brachii, as well as the supraspinatus tendon will be sore. You can find the supraspinatus tendon by putting your hand behind your back. If you don't have to go up this far, it can just be as far as you can get it, and it'll feel ropey and knotty and tender. And you can just take your fingers and you can rub for 2 minutes, and you just rub and rub and rub and rub. It eventually becomes a little less sore as you do this. So you can do this exercise daily, just helping break up some of that scar tissue, and something you can do for yourself. Stretching, again, the pecs. Some people really love tricep stretches as well, or foam rolling the tricep. So you can, in order to do that, you can just stick your arm straight up on the wall and lean into it. So you're just kind of leaning into the stretch. You'll provide resistance. You'll feel it, and as well as some lat. Foam rolling the lat, you can do that as well. Pretty much if you go through my upper extremity video on foam rolling, any of those areas that are sore, where you get the tenderness and pain, go ahead and hold those 30 seconds. Strengthening wise, most people will need to really work on those external rotators, as well as that subscapularis will be the biggest two that people need to work on. So in this instance, most people in our society are hunched forward. Very few people are like the opposite problem. So very rarely do I see anybody who is just like hyperextended, going the opposite direction. It's usually forward. So again, Dr. Erin Denil with Rejuvenate Life Chiropractic. I hope the video was helpful. You can find me at rejuvenatelifechiro.com. Like and share and subscribe to my YouTube channel so that you can see more of my helpful tip videos. But this is stuff that you guys can do at home. Again, any of the content in my videos is for informational purposes only. The best thing to do is set up an appointment to come see me, and I can walk you through specifically what's going on with you. But I hope you all have a fantastic rest of your day.